Hello, everyone, and welcome to another edition of the Hindu Wellness Series. Today's webinar on heart failure is presented by Kauvery Hospital. We have with us three panelists who will elaborate on various aspects of heart failure, its prevention and management. Let me start by introducing each one of them. We have with us Dr. K.P. Suresh Kumar, Chief Cardiologist, Kauvery Hospital, Chennai. Dr. Suresh Kumar has been practicing active clinical and interventional cardiology for the past 25 years. He has extensive clinical and management experience in the field of coronary artery disease, cardiac failure, and hypertension. He has performed more than 17,000 coronary angiograms and has done more than 5,000 coronary angioplasties, among other procedures. He is an expert in performing radial artery interventions. He received the Best Doctor Award from the Indian Medical Association in 2018. We have with us Dr. S. Aravinda Kumar, Chief Consultant, Interventional Cardiologist, Kauvery Hospital, Trichy. He has performed more than 5,000 angioplasty procedures, over 15,000 angiograms, and more than 250 permanent implantations and device closures. Among his areas of expertise are renal stenting, multi-vessel angioplasty, and peripheral angioplasty. Primary prevention camp once in 3 months, valvular clinic, arrhythmia clinic, and heart failure clinic are among his clinical achievements. I'm sorry, there's a power cut here. We have with us Dr. P. Manokar, Senior Consultant, Interventional Cardiology and Clinical Lead, Heart Failure and Transplant Program, Kauvery Hospital, Vadaparani. He is a multifaceted interventional cardiologist with special interest in chronic total occlusions and structural interventions. His areas of specialization include complex coronary interventions, structural interventions, heart failure, heart transplant, and pulmonary hypertension. He has done more than 4,000 therapeutic procedures. He has received a number of awards for his clinical services. We welcome all of you to this webinar. Before we begin, participants who have logged in can post their questions in the Q&A box, and we will take it up at the end of the session. Thank you. I will now invite Dr. Suresh Kumar to give us an overview of cardiac failure. Over to you, sir.
Thank you, Serena. Good morning, dear viewers. Let me just. Hope my slides are visible. Good morning, dear viewers. At the outset, I would like to thank the Hindu and Kauvery Hospital for giving us this platform. Today is a World Heart Day, and we thought we will discuss about a topic where the prevalence and incidence is rapidly increasing. So I will give an overview or set the ball rolling about the subject, that is cardiac failure. Now, first of all, I would like to define three critical cardiac conditions, that is cardiac arrest, heart attack, and heart failure. People have some confusion about this. Cardiac arrest means your heart stops, and there are a lot of conditions which can produce cardiac arrest, which is beyond the scope of this meeting. When the heart stops, you have to do a cardiopulmonary resuscitation, you have to give oxygen, you have to put the patient on ventilator, starts on medicines to increase his BP, and starts on life support system. So cardiac arrest, if you are not treating, patient will die within a few seconds or minutes. Second is heart attack. Heart attack happens when there is blockage of these tubes which supply blood to the heart. These are called coronary arteries. Now, when these tubes get blocked, people suffer a heart attack and all the complications related with heart attack. This is a very common cardiac condition. However, nowadays we have got very good treatment for treating an acute heart attack, like primary angioplasties, thrombolytic therapy, so on and so forth. And third one is the cardiac failure, which is the topic of discussion today. Now, heart failure means your heart muscle is weak, heart is not able to pump adequate amount of blood for the needs of the body. So it can be because of the impaired heart muscle power. Heart muscle is pumping only less powerful, it is pumping less amount of blood. Or sometimes it can be because of the stiffness of the heart, which produces fluid accumulation in the lungs and peripheries. So these three conditions are different clinical entities, that is cardiac arrest, heart attack, and heart failure. Today we will confine our discussion to heart failure. Why? Because the prevalence and incidence of this condition are rapidly increasing, and it is called heart failure epidemic. There are nearly 62 million people all over the world with heart failure, and the incidence again is rapidly increasing. Why heart failure is increasing now? Because first is the aging population. The lifespan of the patients are increasing globally. So it's a disease attached with advanced age and other comorbidities, that is increasing prevalence of risk factors. There's a very high incidence of diabetes mellitus world all over, hypertension world all over, and other conditions like renal disease, so on and so forth. Third one is impaired post MI survival, that is previously the death due to heart attack were very high. However, now with the availability of advanced primary angioplasties and advanced medications, the death due to a heart attack are much less, so that these patients will survive and they develop pump failure in long run after several years. Now, what is the incidence in India? Incidence in India is roughly about 1%. It comes to about 10 million people with heart attack. 10 lakhs. Now, heart attack is a bigger challenge in India. Why? Because in India, compared to the Western counterpart or Western to the Western world, we develop heart failure at a much younger age, almost 20 years earlier. And whether in the hospital or if you take the medicine as an outpatient, the death rate is much higher compared to the Western counterpart. So we are more susceptible to the death due to cardiac failure. So in India, the heart failure appears very early in the course of his life, which has got a rapid progression of the disease, which we call a malignant course, and affects a much younger age group. So that is all the more important for Indian patients. Now, what is the death rate? Suppose the patients have mild symptoms and they are taking treatment at home. That is symptom, general routine activities, there is no problem. Only when they climb step or walk, they have breathlessness or other symptoms. Still, the 3-year death rate is 30%. I am talking about the death. That is, one third of these patients will die within 3 years. Whatever treatment you give, 50% of these patients die within 5 years. So this is a disease which is associated with a very high death rate. Another important thing is that this is a treatable disease. Once you detect this disease very early and start appropriate life-saving medications. Now, again, one more point to think. People think that people all know about the various kinds of cancers and now that the cancers will kill the people. However, you compare the breast cancer, which everybody is aware of that. And if you see 100 patients with breast cancer and treat them with appropriate therapy and follow them for 5 years, 89% of these patients will survive at the end of 5 years. That is, you are talking about the breast cancer, treat them for 5 years, 89% will survive. You see the heart failure, you see 100 patients with heart failure, and treat them for 5 years, 52% of these patients will die. So the death rate is almost 8 to 10 times higher than the most of the cancers which you think. So this is worse than a cancer. However, again, in the same breath, I will say it's a treatable disease, provided the disease is detected very early before the progression of the disease to a higher stage. Now, what are the common causes of heart failure? One, diseases associated with the heart, that is the heart attack, diseases of the heart walls, inflammation of the heart muscle weakness, which is called cardiomyopathy. However, two common diseases which public should know are, one is diabetes mellitus. There's a very high incidence of heart failure in people with diabetes. And second is blood pressure. You see, India is considered as the diabetic capital of the world. There's a very high incidence of diabetes and hypertension in India. And these two diseases are are very important causes of heart failure. Other as kidney disease, pregnancy, anemia, and chemotherapy, because cytotoxic chemotherapy with cancer, so on. People should remember that diabetes and hypertension are the common causes. Suppose you have heart failure. How will you detect it before you go to the doctor? Most important symptom is shortness of breath. People say, when I am walking my stairs, I will have breathlessness. Or people say, I used to walk daily 2 kilometers. When 1 kilometer, I develop breathlessness. I have to pause for some time. You have to see your physician, cardiac physician, or your family physician, and rule out heart failure, which is one of the causes of this breathlessness. Breathlessness is the commonest presentation of heart failure. Second is unexplained tiredness. They say, I'm feeling very tired. They need some checkup to rule out cardiac failure. And third important cause is persistent cough. Persistent cough, it can be because of respiratory infection, but if it is not getting cured, especially in the absence of fever, and people say, my cough is more after sleeping. Night, I get up after 12 midnight with cough and breathlessness. It is not respiratory infection. It is a symptom of heart failure. This is what public should know. And a fast heart rate, they'll have palpitation, swelling of the legs, and weight loss. Commonest symptom is breathlessness. Gradually, your functional capacity or effort tolerance comes down, unexplained tiredness, and persistent cough. One thing about heart failure is that it's a rapidly deteriorating course. Once you get admitted with a heart failure, there's a rapid downhill course, and you will never become, you can regain the heart function as before. Now, again, this is the graph which shows the first hospitalization, second hospitalization, third and fourth hospitalization. Each time when you get hospitalized, you are stabilized, getting discharged, the death rate is increasing. Now, how will you diagnose heart failure? Go to your cardiologist. They will do a simple blood investigation by NT-proBNP, which will be elevated, ECG, X-ray, echo, and if necessary, coronary angiogram. Now, once you diagnose heart failure, once you come to the treatment of heart failure, diet and lifestyle are the cornerstone of therapy. You should take a diet in which there is less salt and less water. You should restrict your water intake, restrict your salt intake. Very, very important. I have seen people taking very good medication, correct medication with good follow-up, but they are not restricting salt and water intake. Restriction of salt and water intake is the cornerstone of therapy. Second is maintain optimum body weight. And third is avoid smoking and alcohol, and regular physical exercise, especially a supervised cardiac exercise, which is called cardiac rehabilitation, goes a long way in preventing the progression of the disease, or you can do a reverse remodeling of left ventricle. Another thing is that patient will say that I am stable with her. They come to your OPD, they say, doctor, I am taking this medicine, I am perfectly all right. Is it necessary that I should take this 4 to 5 medicine? It is very, very important that once you start this treatment, you have to take this medicine lifelong. Why? Because first of all, you say stable because you don't have any breathlessness or cough, but there's an underlying progress of the disease, the tip of the iceberg we call. The disease, there's a molecular progress of the disease, there's gradual damage to the heart muscle fibers. So over a span of several years, you will develop refractory or frank cardiac failure. So it is very important that even if you improve with the medication, even if you are free of breathlessness and cough, you must take this medicine lifelong. Maybe you can adjust the dose of medicine which your cardiac physicians will tell. And I started my talk telling that the death rate of this disease is much higher than most of the cancers. So suppose if your heart function improves and you are better, please don't lose the advantage. So these are the 4 main medicine which are available, which is called SGLT2 inhibitors, RNA, beta blockers, and MRA. These are all the medicine which has come to our medical practice for the past 10 years. These are really life-saving medicine, which called 4 pillars of treatment. If you give all these medication, 75% of the people will survive. They had a good lifestyle. Their lifespan increases. You will have a symptom-free survival and reduction of mortality, 75%. The only thing is that this has to be initiated very, very early before you develop frank heart attack. And you get almost 8 to 10 years of extra life. 8 to 10 years of extra life is great, especially I compared with the cancer. If you live 8 to 10 years, fine, you can see your children marrying, their children, their studies, a lot of things. We can see the life. Then a couple of slides more before we end. This is the stages of heart failure. Now, heart failure is divided into stage A, stage B, stage C, and stage D. Important is that stage A is only the risk factors. That is, if you have got hypertension or if you have diabetes, you are in stage A heart failure. You think about India and you think about the prevalence of diabetes and hypertension. If you are diabetic or if you are hypertensive or if you have got COPD or metabolic syndrome or something, or renal disease, you are in stage A heart failure means 80% of the Indians are in stage A heart failure. Why it is important is that you should detect subtle signs of heart failure at this stage itself and start appropriate therapy so that you will not progress to further stages. Stage B is the structural changes of heart failure, in the heart, but still they don't have any symptoms of heart failure. Stage A and stage B are very important because if you start appropriate therapy, they will not develop symptoms of heart failure. So initiate the treatment very early, detect subtle changes of heart failure, and initiate the life-saving therapy early so that you will not progress and develop frank heart failure with this dreaded complication. So, dear friends, in conclusion, the incidence of heart failure is rapidly increasing. We can even say there is a heart failure epidemic, and it's a disease which is associated with very high mortality. However, the good news is that it is a treatable disease. You can do reverse remodeling of heart pumping function will improve, you will also improve, your longevity improve, your functional capacity improve. Only thing is that it has to be detected very early. An appropriate life-saving therapy has to be instituted, and you have to take this medicine lifelong. Never stop the medicine even if you improve. And proper control of cardiovascular risk factors are of paramount importance, especially diabetes, blood pressure, renal disease, and your weight. Early detection and prompt initiation are very important, and they are the key to reduce the death and hospitalization. Apart from medicine, lifestyle modification, dietary modification, and doing mild physical exercise are all very important. You need a regular medical follow-up. There are heart failure clinic, dedicated heart failure clinic in some of the hospitals, which will be very useful for heart failure patients. Never stop the medicines. Thank you very much for your attention. Over to Serena.
Thank you, sir. I now invite Dr. Arvind Kumar to give us his perspective. Over to you, sir.
Morning, everyone. Thanks for the opportunity. It was a fantastic talk by Dr. Suresh Kumar, sir. So it remains the same. Whoever talks the heart failure remains the same. So I will just share some ideas of my understanding so that the people can understand much better. So what is heart failure? Sir was talking about heart failure, cardiac arrest. Uh, so heart failure is whatever the body, every organs in the body requires X amount of blood, which carries oxygen and nutrients. If the heart is not able to pump blood, which is required for all organs of the body, then we call it as heart failure. That's a simple definition for all the public. So I'll make it much more easier to understand. So this cartoon will make you understand when the heart is failing, it means that the heart is finding it difficult with the load with which it is carrying, and it is also climbing up. So this is the state with which our heart will be functioning when the heart is failing. So it means that the load, that means the supply to all the organs is not commensurate. And more importantly, it has to pump against something else. We call it as afterload. So it has to pump again. Heart has to work against some extra pressure. So this is what heart failure is all about. So it is not an easy. That's the reason it is worse than cancer. But only thing, identifying early and treating it early makes the heart failure treatment much more easier, and the patient can live literally a near normal life for a longer time. So this is what the load I am talking about. You can only give certain amount of load to the heart to make it function properly. That is what we call it as in our terminology preload. If it exceeds, then the heart cannot do the job. So it will be flooding the lungs or other organs. At the same time, heart cannot pump against extra load. That is, we call it as afterload. So that's also is when it is on the higher side, heart will over a period of time get tired of because the afterload is just extra. So this extra effort when the heart puts in, it gets tired out and becomes weaker. So this is also called as heart failure. Now you understand what is heart failure. Heart is not able, it can only withstand certain amount of load beyond which it cannot function, and it cannot pump against extra load. So this is what the heart, and we have to have a balance between the two. So the common public will always question how much percentage the heart is functioning. So this makes you simple. Whatever comes in, every blood, ounce of blood or ml of blood doesn't go out. It's a fraction of blood which comes to the heart only goes out. This is what we call it as ejection fraction. This makes the number easier for us to communicate and for the public to understand. Usually it is around 60 to 70%. So it means only whatever comes in the residual, some 30-40% is there, and it only pumps some 60-65% only. So this is the normal efficiency with which we can always manage. In heart failure, what happens? This efficiency comes down to 40, 30, 25 like that. So more the lower the number, more severe the disease, more likely the patient is going to die. So this is why the reason that numbers are very important and understanding the cause and treating the cause. So I was talking about understanding the heart failure. So heart is the engine. So it only supplies blood to all parts of the body, and it receives all blood from all parts of the body after purification. So whenever it receives, if your heart is acting like a dam and it's not allowing extra fluid to come inside, the lung gets congested. That's the reason why the lung, the patient coughs at night, become breathless. While walking, they may feel breathless, and while lying down, they feel breathless and they cough, and especially during night. So this is what happens when the heart is not able to receive the extra amount of fluid, or when if it is able to receive, when the heart is not able to pump that blood out of the heart, it means that it is going to dam it out in the lung. So when it is on the right side, when you have extra fluid circulating in the body, it accumulates in various parts of the body. I was talking about in the lungs. When it accumulates in the legs, you always feel there is a pedal edema. We call it as edema in the legs. So this edema legs only says that the heart failure is much more severe and it is accumulating lot of fluid in the body. So this is the reason why you need to measure weight daily also. So there is accumulation of fluid happening everywhere. When it is happening in the lungs, it is there. So this also happens when you have decreased blood supply to the brain. Heart is not able to pump blood. So brain is getting the decreased blood supply means the patient feel tired and they feel fatigue, they have giddiness. So many things happens when you have organ perfusion, decreased organ perfusion. That similarly happens when the liver is not able to have adequate blood supply or is wetted with lungs, fluid in the liver. The ability of the liver to function properly is also lost. It is like akin to having a jaundice. So where heart failure can, over a period of time, can develop liver failure also. So this is it's not a single heart is a pump, an engine, and it's only a single body which is functioning. Once it is one organ is failing, it is going to have a action on other organs, and it is going to completely lock, and the occupation is going to fail. So the etiology wise, it is commonly we call it as heart inability of the heart to pump blood. It is called systolic failure, where you have the number 30%, 40%, everything. And sometimes heart is not able to relax properly. So this is also a newer entity which people will not understand. So we are able now, we are only talking about the pump, but at the same time, there is an entity called not relaxing properly. That also will flood the lung and also will cause decreased blood supply to the organs. So this is also equally dangerous and equally worse. So you have to understand both forms of heart failure is there. So whenever the heart is failing, what is it? See, heart is like you imagine a rubber band. When the rubber band is stretched up to a point, it regains the original position. Beyond which, if you are able to try and stretch the rubber band, it will never regain a position. So this recoil effect will not be there. This is what happens in a heart failure. The heart is trying to overwork and accumulates blood and trying to pump blood to the requirement of the body. But it is not happening when it is stretched beyond, failing beyond a limit, it enlarges and becomes useless because it's not able to pump blood to the needs of the body. So this is what is irreversible heart failure, where you will have a further progression of disease and worsening of disease and have high mortality. So you have to ensure that it doesn't happen. This is the ultimate treatment of heart failure. When it is there, ultimately it is where fluid is accumulating in the body and it becomes an medical emergency and patient dies during one hospitalization and one index failure. So who are the patients likely to have heart failure? It's predominantly the risk factors like diabetes, hypertension, smoking, obesity, dyslipidemia, either valvular heart disease. And the common cause in the middle age, after the middle age, we come across is coronary artery disease. Most of the time, having a heart attack, and these patients come late to the hospital, they have more myocardial damage and they have heart failure. So what are the symptoms? As previous speaker was mentioning about, there is breathlessness, swelling of legs, lack of energy, and swollen or tender abdomen. Say there is basically accumulation of fluid in every part, and the heart is not able to pump blood, means there is decreased urine, further accumulation of fluid, and there is decreased blood supply to the brain, means there is confusion, giddiness, and memory loss. So the symptoms are varying, and it will mimic some other symptom also. And more importantly, if we have a cluster of symptoms and we have a history of heart attack, possibly we are dealing with a heart failure, which requires heart failure specialist treatment. So personally, these people will die during one of the secretions, which accumulation of fluid and secretion happening inside the body. And this is what we do not want, and we want make appropriate, accurate treatment for it. And the complication wise, it is not about pump failure alone. Patient will have breathlessness because of the pump failure, and real accumulation of fluid, everything will happen. But the patient can have a sudden cardiac death because of the heart is weak and muscle is weak. It cries by having an arrhythmia, and there is a irregular heartbeat happens during one occasion, and the patient can have a sudden cardiac death. The heart failure patient, as Sarah was mentioning about, almost every year, 10 to 15% of the people are lost because of heart failure, and partly almost 50% of the people die of sudden cardiac. They have a sudden cardiac death because of the arrhythmia, which is there associated with heart failure. And over a period of time, the heart is failing, means it fails other organ also. The chief organ which is failing is kidney. We call it as cardiorenal syndrome. And the lab investigation wise, we need to do everything to confirm the diagnosis. First of all, heart is involved, and whatever the possible reversible cause of heart failure has to be identified and treated. This is the whole purpose of investigation. So do not think that we are trying to over-treat or over-diagnose here. It is the point where we are trying to understand the disease, make them analyze the disease and have a correct diagnosis. That's the reason why we are trying to do it. Prognosis-wise, see, the worldwide data is very clear. The moment the patient becomes symptomatic, there is a very, very rapid downhill course. Symptomatic means the patient walks. I do a normal activity like walking 100 meters daily without a discomfort. Now I find it difficult. I will be able to climb one flight of stairs. Now I find it difficult. These are all symptoms with which heart failure comes. Once the patient becomes symptomatic, the prognosis is worse, and every year we lose around 15 to 10 to 15%, and by 5 years, most of the time, if it is not properly treated, not intervened, 50% of the people are dead. And if it is asymptomatic, we have to ensure that lifestyle modification is the best way of treatment. We have to control hypertension, diabetes, dyslipidemia, and whatever the possible way of treating the coronary disease like a angioplasty or a bypass surgery, adequate medication, and all the medication for heart failure has to be instigated. Once it is there, possibly we will be handling heart failure in a better way. And that's the best message to the community I want to give. Thank you very much for your listening.
Thank you, sir. We will now have Dr. Manokar, who will elaborate on the future directions in the treatment of heart failure and as well as living with heart failure. Over to you, sir.
Manohar, just unmute Manohar.
I'm sorry. Thanks the Hindu as well as thanks Kauvery Hospital for giving me an opportunity. By being the last speaker, I have a big advantage. So all my previous seniors and mentors have already covered all the key issues in heart failure. So I have a presentation of which I deleted 90% of the slides. So I'll directly jump and talk about future directions in heart failure, because the treatment aspects and many of the clinical aspects have already been discussed in detail. So I'll just elaborate what we expect in the future in terms of treatment in heart failure. So in future directions, obviously, we'll be looking at the future drugs which are in the pipeline. Then we'll talk briefly about the gene modifications that are in place that are happening in treatment of heart failure. And then our pet topic, heart transplant. And also I will throw a little light on the device therapy that is evolving in the field of heart failure, talking about mechanical as well as electrical devices. If you look at I'm talking as if these things are very far away, but whatever I'm talking is going to be there in the next 5 to 10 years available to us for most of our patients. So these are the new drugs which are under trial in phase 3, phase 3B, trials which are expected to hit the market. The omnicamtim is already available. It has been approved by FDA for particular indications in heart failure. Rest of the drugs like ularitide, serelaxin, they are all being studied. 12-valproate is still is already available, but a newer trial with newer dosing regimen is being evaluated for efficacy in heart failure. The SERCA2A inhibitor, those drugs are also being in the pipeline. Moving on to gene modification. Now, since a lot of heart failure is genetically mediated both in the domain of hypertrophic cardiomyopathy and dilated cardiomyopathy, we are getting silencing molecules. We are getting specific gene modifiers which are being developed. So, but this is very useful if there is a proband in the family and the family is identified to carry that gene. But the biggest challenge that we face in heart failure and genetic management is most of the patients are new mutations, are novel mutations. So to put things in perspective, when you look at hypertrophic cardiomyopathy alone, there are some 3,000 gene mutations which have been identified in patients with hypertrophic cardiomyopathy. So it is little tricky to design a gene therapy which will fit all. So definitely, if there is any field of cardiology where pharmacogenomics is going to play a big role, that is going to be in genetic treatment, where you identify the gene in the proband, and maybe if the children have inherited the same gene, then you try to target them with this gene therapy. This definitely, I am confident I may see by the end of my lifetime. Moving on to transplant. So what is new in transplant? Transplant is absolutely an old topic. The first transplant was done way back in 1967, and every year around 3,000 transplants happen in the US. So nothing special. But there's one special issue which I want to elaborate is the concept of what we call as donation after circulatory death. So traditionally, if you all know that most of the donations that happen after brain death, that is, the patient has a brain damage, irreversible brain damage. Two group of neurosurgeons declare that this patient has a brain damage, and then he's declared as brain dead. Then the system is activated and the family consents for donation, and then the whole process of donation happens. But somewhere down the line, people realize there are a lot of people who have circulatory death and a irreversible cause. That is, they have their blood pressure gradually plummets, say 100, 80, 60, and then the patient dies. If this group of patients can also be brought into the pool of transplant, the number of donors available is expected to increase exponentially. So this is a very novel concept. This concept originated in Australia, and where they formed the guidelines as to how circulatory death is to be declared and how the patient's organ perfusion and everything is to be maintained. Now, subsequently, the US has copied the model. Europe, Britain, all have legalized donation after circulatory death. We in India, still this is not legally permitted, but I strongly believe this will be the way ahead, because this is a major landmark change in the organ procurement that is available today. So to put things in perspective, we have to understand that in patients, once you have circulatory death and then machine perfusion, you are able to increase the duration to which the heart can be used. So put things in simple perspective, whenever we have a normal heart transplant, the time available for us is maximum 4 to 6 hours. But in these kind of scenarios, we can significantly increase the duration to which what we call as a cold ischemia time, which can be utilized for a longer period of time. So this is going to revolutionize the way things are done. So this is just an example of the fact that from 2008 till 2019, when DCD donations were approved, the graph was growing in a very kind of a linear fashion. But after DCD was legally permitted, there's almost like a takeoff in terms of number of donors available. I'm very proud to share that the person who is responsible for this is Dr. Kumud Dittal, who is part of our team at Kauvery Hospital, Vadapalni. He is the pioneer of this technology, and he was the first person to publish on this from Australia. And although it is legally not yet there in the country. Eventually, this is expected to boost heart donors, and improve outcomes. Uh, this is something which has got a lot of media attention, what we call a xenotransplant, that is about the pig transplant. But I personally feel this is more of a media hype, because this has been tried for many times. It creates a lot of news bites, but eventually all these patients don't make it to their first birthday. At the end of the day, the success of a transplant is not the next day's newspaper story. The success of a transplant is a 1 year survival of the patient and long-term survival of the patient. And that in that context, I personally feel xenotransplants may not see the light of the day. The future directions, definitely ABO incompatible transplant, that is giving an A positive heart to a B positive person. This is a dream today, but the nephrology people are leading the way. The Japanese have shown very good results with ABO incompatible transplant. So maybe somewhere down the line, we will also reach the same level of success that the Japanese people have achieved in terms of ABO incompatible transplant. I'm not a big fan of xenotransplants. Definitely newer drugs which modify the inflammatory basis of heart failure are in the pipeline. They are expected to give us more insight into how to manage heart failure. Stem cell is another area where you see lot of articles, lot of news bites, but somehow I'm not very positive or very optimistic about stem-based therapy. Moving on to the devices uh, which are available in heart failure. So if you look at electrical devices, now we have two devices which are approved for improving heart failure patients. One is called as the CCM therapy, that is cardiac modulation therapy, where we try to pace the heart at a particular part in the action potential of the heart, and that is supposed to improve the contractility of the heart. This received FDA approval recently, and in these kind of patients, this kind of patients, there is some benefit for people who are not suitable for transplant. In those kind of patients, this kind of devices can be considered as treatment options, and it has got an FDA approval. It is nothing but a pacemaker to stimulate the heart. Similarly, another thing which has got an approval is BAT, that is baroreceptor activation. This is again a pacemaker, but it tries to act on the carotid artery based on the carotid sensors in the carotid artery, and this has also been found to have impact on heart failure. These are the only two FDA approved devices in the field of heart failure. Other devices are in the pipeline. Before I conclude, we all know that left ventricular assist devices, that is artificial hearts which pump blood, are the final destination therapy for patients. But today, the biggest challenge is these devices need a lot of energy. So you have the device inside and you have a battery coming out, and the patient has to wear the jacket to which the batteries are connected. This is a landmark device developed by some people in Israel. And if you look at this device, the idea is it is the same technology that we use for our phones, or phones for wireless charging. So these kind of devices are being developed, and this is in early stages of trial. This is how the device looks like. It is basically a device which is fully implantable. There's no wires coming out, no batteries, nothing. But patients can, like we charge our phones at night, this heart can be charged at night. And this heart bat, and what they claim is like maybe 6 to 8 hours of charging at night is sufficient for the patient to work the entire day. I know it looks like James Bond movie, but this is kind of things that is going to be the future, where people because we have to understand that heart transplant, however attractive it looks, there is so much of gap between the need and availability. If you look at the waitlist mortality in the West, the waitlist mortality itself is around 60 to 70%. That means in the West, 60 to 70% of patients who need a heart transplant die waiting for the heart. So although I'm a very big fan of heart transplant, but I know the limitations between the need and the available resources. The number of donors and the number of recipients is always going to be a huge gap between the need and the availability. So for example, average waiting time in the US is almost like 2 to 3 years. This is just to demonstrate that normally patients with an LVAD cannot swim because they have wires coming here. The patient is able to swim, but this is just an indication of the future. Thank you.
Thank you, sir. We will now move on to the question and answer session. We have some general questions as well as a few specific ones. I'll start with the general questions. Um, Dr. Suresh Kumar, can you take this question alone, sir?
Yeah, please.
Can we predict the possibility of heart failure earlier on a healthy adult, say if he or she is in the 30s or 20s? And is this a fact that men are more susceptible to heart failure than women?
Yes, the heart failure can be predicted. We have a lot of markers for heart failure. Most important is the blood test NT-proBNP. You do NT-proBNP, especially nowadays, all patients with diabetes, blood pressure, and other cardiovascular risk factors which predisposes to heart failure should do NT-proBNP at least once in a year. If NT-proBNP is elevated, it's a marker. There are other conditions also where NT-proBNP is elevated, but this is a marker which tells you that you are a person who are more prone for cardiac failure. Then you do other tests like echocardiography or if necessary cardiac MRI, if necessary coronary angiogram, nothing. So one way to predict is do an NT-proBNP. If it is elevated, then you do further tests like echocardiography, ECG, so on and so forth. Important is that once it is elevated and you say the early evidence of heart failure, this is the best chance for you to start all the treatment for heart failure so that it will not progress further. You will have a healthy cardiac parameters and healthy life.
Thank you, sir. Another question is on the connection between cholesterol and heart failure. Is it related? And since you said salt and water intake should be managed, can you suggest any other food habits that should be followed to maintain the normal activity part? So, can you answer that as well? Because you mentioned about salt and water intake, sir.
Okay, fine. See, salt and water restriction is very, very important in a person with cardiac failure. Especially, I told you, in my presentation also, there are people who take medicines regularly, but not restricting fluid. They get hospitalized with breathlessness, fluid overload, swelling of the legs. Just like salt also, if you take more salt, the equal amount of water is also retained. Secondly, these things are bad for the kidneys also. So if the most of the people with heart failure will have some amount of kidney failure also. So both are both sides of the same coin. So salt and fluid restriction is very, very important. But you said apart from that, anything else to be done? Yes. When you take food, it's a frequent small meals. Never fill your stomach. So frequently, you take small amounts very frequently. Take a balanced diet. You should not take absolute bed rest. Even if you are in frank advanced heart failure, you must do small walking inside the house. Cardiac rehabilitation is very, very important to improve the cardiac functions and improve the longevity. Thank you.
Thank you, sir. Dr. Arvind Kumar, there's a question on genetical inheritance. I think they mean family history. Does it also affect heart failure, sir?
Definitely. You see, most of the diseases, whatever said and done, are determined by genetics. So it runs in families, whether it is heart attack or stroke or renal kidney failure, it runs in families. And there are genetically susceptible individuals, like Dr. Manohar was pointing about hypertrophic cardiomyopathy. So these are the diseases which runs in families, and one of the family member is affected means we need to screen the family, either the parents, sisters, and children, the brothers and offsprings. So this runs in families. There is no doubt about it. But only thing is, for us in a country where diabetes is on the run as well as myocardial infarction is very much on the higher side, what we call it as the capital of the world, diabetes and hypertension. So this run, is it running in family means less, more of an heart attack runs in families, and there more and more, we call it as anticipation. That means the parents have a heart attack at around 50 years means the offspring, the children will likely to have it at least 1 decade earlier. So we call it a strong family history of coronary disease, and this happens in the background of diabetes, hypertension, and cholesterol. So the genetic plays a major role in determining the outcome of the disease.
Thank you, sir. So, Dr. Manoka, you touched upon the gene-based therapies. A participant wants to know if there's any cell-based or gene-based therapies currently practiced throughout the world, sir.
No, I would be very categorical. None of them is approved therapy as of now. So in cardiology, genetics are still lagging behind other fields. So if at all we have closest we have come to genetic modification is with respect to cholesterol reduction. So for example, we have commercially available silencing RNA drugs which try to kind of genetically modify your cholesterol production in the body. So that is commercially available today. So it's almost like getting a vaccine for cholesterol. So that is like you take it once in 6 months. That technology has reached a stage of approval. But other things, genetic thing is in too much of infancy to be called as an approved treatment today. All is part of research work only today.
Thank you, sir. So there's a question regarding working out and seeing people dying all of a sudden. So I have a connected question as well. So can overdoing exercises or strenuous exercises cause a burden on the heart that could lead to a heart failure, sir? Dr. Suresh Kumar, can you answer that, please?
Yeah, it's a very, very interesting question. We see it nowadays. I'm sure my colleagues also will have some comments to say. And see, these people who are going strenuous physical exercise, like going to gym and doing exercise very vigorously for several hours, we have seen sudden cardiac death happening in such patients. It's very, very rare, but it is there. It's a reality. It generally happens in young people, and it will be generally because of coronary artery dissection. It's very, very common. The coronary, there's a tear in the artery which supply blood to the heart. Immediately the clot will form and they will just drop down dead. They will have arrhythmia. They will dead. So coronary artery dissection is very, very, it's not uncommon in a young man who does strenuous physical exercise for several hours. So generally, it's not a cardiac failure at all. It's a heart attack and they will sudden cardiac death. However, there are certain underlying conditions like hypertrophic cardiomyopathy, which if it goes undetected, or severe aortic stenosis, if the patient do heavy exercise, they can have a sudden death. So one is an underlying cardiac disease, which predisposes to sudden cardiac death. Even nothing there, a healthy man, when it is doing exercise, when such problem happens, it is because of coronary artery dissection. So generally, I advise my patient not to do any heavy physical exercise. For what? It is only for people who are going to Olympics or something like that. You do an exercise which is good for the health. It should be conducive for your health, conducive for your habit. Other people will be doing it for different needs. For you, it's a health. The exercise which you are doing should be useful to the body, which should conducive to the body. Your body should go along with the exercise. Don't do anything new, any strenuous exercise. You are not going to achieve anything by that.
Thank you, sir. Dr. Arvind Kumar, there is a question on does alcohol and obesity have a role to play in heart failure, sir?
I'll split this two into two, obesity and alcohol. So obesity, especially in Indians, where we have abdominal obesity. So this is the abdominal obesity which is around the visceral, that is all your stomach, spleen, liver, everything. When there is we call it as visceral obesity, this is a factory of hormones. So this factory of hormones means all the bad hormones, whatever is being secreted and circulated in the body, is being secreted from the abdominal visceral. So this abdominal visceral fat is the one which secretes. It means that it determines the patient whether they will have diabetes, hypertension, dyslipidemia, metabolic syndrome, heart attack, renal failure, stroke. So simple. Obesity, I'll make it much more simpler. The height of the patient centimeter minus 100 should be possibly an ideal weight. And the abdominal circumference less than 90 centimeter should be a possibly ideal abdominal circumference. If it is not there, if it is above that, it means that the abdominal visceral fat is on the rise. And more importantly, it can lead to a lot of problems like diabetes, hypertension, dyslipidemia, and heart attack, stroke, and renal failure. Once the patient survives, if they come late, they lead to heart failure and they die of heart failure. So this is related to obesity. I gave you the solution also, how much to have it. And alcohol, there is always a myth, moderate amount of alcohol is good for the heart. coronary artery. It's a totally a myth. Alcohol in a cold climate like your European countries or the Western countries and the Americans, where it really temperature is very cold, you require some vasodilatation. For that, the alcohol is been advised. And there the trial was done and it was proved that vasodilating in the people have more benefit in coronary disease. Now in our temperate climates where already it is too hot and we are having intense vasodilatation, no augmentation of vasodilatation happens in any artery, and you are going to have it for pleasure. And alcohol chronically can also cause heart failure. We call it as alcoholic cardiomyopathy. And alcohol can cause more often cancer in liver. You have to have that is not only heart. You have to understand that it's the whole body we are dealing with. Alcohol can have impact on the cerebellum of the brain and have unsteadiness of gait, memory loss, cancer on the liver, and more often you give marital discordance and disorder, and these things will continue. So obesity and alcohol is very much a social factor which needs to be addressed, and if it is taken care, heart failure is part of the thing which is going to get benefit out of.
Thank you, sir. Dr. Manoka has a very specific question. What is LAE, I think left atrial enlargement? Is it a serious problem? Can you answer that, sir?
No, left atrial enlargement is left atrium is one of the chambers. It receives blood from the lungs and gives it to the left ventricle, which is the main pumping organ of the heart. So when you look at left atrial enlargement, that means there is something wrong. Either the blood is not going easily into the left ventricle, or there is a pressure coming, more pressure is coming from the lungs. So both can lead to a atrial enlargement. Left atrial enlargement is not a disease. It is a consequence of a disease. It's a hemodynamic consequence of disease. So the commonest reason that left atrial enlargement occurs is if there is mitral stenosis, that is the mitral valve is not opening. Obviously, back pressure changes happens and the LA enlarges. This is would be the commonest reason that left atrium enlarges. The other common conditions which are clinically important would be patients who have heart failure. So if the heart is not pumping well, the patient has mitral regurgitation and all the blood goes back into the left atrium. So mitral valve disease would be the commonest reason for left atrial enlargement. But when you look in the general population, the common reasons would be basic things like hypertension, like a long-standing treated hypertension. And as sir mentioned about diastolic heart failure, in patients with diastolic heart failure, in patients with restrictive heart disease, in all these conditions where the left atrium finds it difficult to pump into the left ventricle because of a stiff ventricle, these conditions also lead to left atrial enlargement. Left atrial enlargement should be not considered as a disease, but as a marker of something wrong. And either it is mitral valve disease or a stiff ventricle or some issues related to the lung. So if somebody has a left atrial enlargement, I would try to find out what is the cause. Is it mitral valve disease, stiff ventricle, poor ventricle, or some lung disease? Based on that, my treatment strategies will vary. I just wanted to add a point to what Dr. KPS sir told. This endurance exercising is something as a cardiologist I never want to encourage. In fact, there is a lot of data that marathon runners end up damaging their heart by doing a marathon. So, for example, sir mentioned about biomarkers. When you take biomarkers as a marker of injury, if you look at biomarkers of people who run a marathon, 95% of people after the marathon will have some elevation in their troponins. Troponins, we all know, is a marker of heart attack. So in general, endurance exercise like a marathon is something I personally never encourage for my patients. It is good to run. As sir said, it is wrong to be inactive. It is very important to be active. But doing this more, and as sir rightly said, we are not going for Olympics. We are going for keeping our heart healthy. So running 10 kilometers is good, but running 42 kilometers is something I never ever encourage in my patients, because we don't know that elevation in troponin is harmful or not, but there is strong evidence that there is evidence of cardiac damage happening when people run marathons. So I, as a cardiologist, never encourage people to run marathons because we don't know whether it is harmful, but we definitely know it damages the heart.
Thank you, sir. Dr. Suresh Kumar, there's a specific question again. Can a patient perform cardiac rehab with shortness of breath?
Yes, this cardiac rehabilitation should be supervised. So all cardiac rehabilitation programs are supervised by a doctor and a trained nurse and a physiotherapist. So in the presence of breathlessness at rest, obviously you cannot do cardiac rehabilitation. You need medical therapy to stabilize your symptoms and stabilize your heart. After that, you do cardiac rehabilitation. The importance is that the cardiac rehabilitation comes after medical treatment. You give medical treatment, stabilize you, your symptoms should improve, your BP, pulse, sugar, pressure, everything should get controlled. And after that, you start the cardiac rehabilitation program. Again, it should be a slower program depending upon your heart rate, your exercise tolerance, your effort capacity, your symptoms. It should be limited with that, and it should be supervised.
Thank you, sir. So there are a couple of questions on diet pattern, and one person wants to know if a patient should avoid high protein. And we also often get to hear a phrase called heart healthy lifestyle. Can you elaborate on that, sir, so that we can cover most of the questions on diet and lifestyle? Dr. Suresh Kumar, if you can take it, sir.
Heart healthy diet, all of everybody knows heart healthy diet means a diet which is rich in fruits and vegetables. Fruits are called protective diet or protective food. It is very, very helpful for the not only the heart, the general health of the body. And vegetables, again, with a lot of fiber and everything, it improves the digestion, it improves reduces your cholesterol. So heart healthy diet is a diet which is rich in fruits, vegetables, the cereals and whole grains, all these things, and then avoid the excess fatty food and avoid this refined uh, wheat, that is we call maida, and then all red meat and everything. Again, the key word is moderation. It is not that you should stop it in your life throughout your life. You can have off and on, but in general you should maintain a healthy diet. Remain well hydrated, very, very important. You should do at least 2 to 3 liters of plain water in a day. So well hydrated, a fruit which is rich in fruits and vegetables, and less of refined oil, less of salt intake, maintain optimum body weight. You can do yoga, meditation, all of this. All these things helpful for a holistic life, for a healthy, not only the heart, or healthy lifestyle and general health, to improve longevity and improve the happiness index.
Thank you, sir. Dr. Arvind Kumar, there's a specific question. Can lung disease also cause heart failure? And there are a couple of questions as well. It says, like, if you have a persistent cough, how can you differentiate whether it's tuberculosis or whether it's a symptom of heart failure, sir? Can you please answer that?
Just repeat the first question. What can lung disease cause?
Can lung disease cause heart failure, sir? And the second one,
Yes, I'll differentiate. I'll
Yes.
just take two questions separately. Lung disease, when it is the heart, you have to understand, it receives all the blood from every organ. After the oxygen being utilized from the body, it comes back from the venous circulation and into the heart, right side of the heart. From there, it goes to the lung to get oxygenated and comes to the left side of the heart, and purified blood goes to all parts of the body. This is what the normal is happening. When the lung is damaged, means it reflects on the right side of the heart. So it means that the blood pumped into the lung is not going to be effective. We call it as afterload. It's pulmonary vascular resistance. That is, the heart is not able to pump blood into a diseased lung. So there is resistance into the blood supply to the lung. So what happened? The right side of the heart enlarges over a period of time, and you call car pulmonary. The heart can enlarge because of the lung disease, and this can result in liver enlargement, pedal edema of the legs. Everything can happen. This is one thing. Any chronic hypoxia can cause any problem in every part of the body, and it includes heart as well. So some directly easily understandable lung disease, definitely yes. For a period of time, not like the heart attack of which involves the left side. It involves the right side, with enlarged heart enlarges and cause a problem. See something. And how do you differentiate between a breathlessness of heart and lungs? So when you have breathlessness, it means that oxygenation is either inadequate or the demand is more. It means when the demand is more, it means you feel breathless. See, after you walk, even a normal person after walking certain steps or certain meters will feel breathless. It means they do not have disease. The demand is more. Where is the supply? If the lung is not able to oxygenate, that if the supply is not adequate to the body, you have breathlessness. It means that when the heart is failing, the lung gets congested, wet, and it is not allowing the oxygenation to happen. or there is a lung disease which also can have poor oxygenation, or there is a systemic disease, kidney failure can accumulate fluid and can cause a problem, and your anemia, all your circulatory state, systemic disease can cause a problem. So how do you differentiate between these two? To make it simple, as the first speaker, Suresh Masar, was pointing out, when the usually when the heart is diseased means the patient will find it difficult to lie in the bed during night. The simple thing. They will be having breathlessness. They will have the oxygen saturation will be lesser. But when the patient during walking, I feel breathless. But during night at 2 o'clock, I wake up with sudden breathlessness. Most often it is from the heart. You call it as PNT. Or I am just taking food, I am just lying down, but immediately after 5 minutes, I feel breathless and I start and I keep coughing. So this is the way differentiate with the breathlessness. What is associated? When you have cough with frothy sputum. It's not a tough mucus, it is a frothy. Then this type of sputum means you are likely to deal with heart, and the sputum is slightly tinged with blood. We call it as hemoptysis, most likely it is there. TB can also cause hemoptysis, but the sputum is more of mucus. That is more thicker. Along with that, there will be a hemoptysis. So patient lying down, breathlessness, walking breathlessness, during night the breathless, and they have cough with frothy sputum. Possibly we are dealing with the heart. Rest of the scenario we are dealing with mainly a respiratory system.
Thank you, sir. We'll take one more question before we move on to the conclusion. Dr. Manoka, there's a question on heart failure in children. What are the symptoms and management, sir?
The
So,
in,
Sir, you are muted.
in children, the symptoms of heart failure are very subtle. The commonest thing that the family picks up is a lack of physical activity, alertness. For a child, the activity is the evidence of normal cardiac stature. So if they find that the child is inactive, kind of sleeping, and kind of not mingling with other children, kind of lying down, these are signs of heart failure. For example, even a newborn child. So suppose it is feeding and it is not feeding properly. It is sleeping in between. So what we call is suckle and then sleep cycles. The child starts crying, starts to feed, then again dozes off, then gets up again and feeds. That means even feeding is a stress for that heart. So these are subtle signs in a newborn child about heart failure. When you look at older children, obviously activity would be the best sign. Weight gain. So the most important thing in children is when the child doesn't gain weight, that's always a red flag. So child doesn't gain weight is always a red flag in cardiology, because that tells something is wrong with the heart, which prevents the child from putting on weight. It could be multiple causes, but when you look at children in general, lack of activity, inactive child, weight gain, and getting tired very easily. Some of the children can have very bad edema and bloated up and can come out with the things. Some children can present with jaundice like picture. Some people can have kidney involvement and present with those kind of symptoms. But the general rule is inactivity, lack of weight gain. These are crystal clear signs that something is wrong with the heart, especially in children.
thank you, sir. We have about 30 to 35 questions more. Participants, all your queries will be answered by email. Any concluding remarks from the three panelists? Dr. Suresh Kumar, please. Any concluding remarks, sir?
Yes, I just want to re-emphasize that heart failure is growing in epidemic proportions. The incidence of heart failure is increasing, and you have not heard about cancer of the heart, isn't it? It is similar to cancer of the heart, or it is the cancer of the heart, its prognosis and death rate and everything. However, one important thing is that one good thing is that it is a treatable disease. A lot of medicines are available nowadays, and newer medicines are available now to reverse the improve the heart cardiac function, or even to produce reverse cardiac remodeling. So only thing is you have to start this treatment early. You should be on the follow by your physician or a cardiac physician, and you should not only take the medicine for heart failure, control other risk factors like diabetes, blood pressure, high cholesterol, your obesity, and anemia, kidney disease, so on and so forth. Maintain an optimum healthy lifestyle and healthy dietary style, so that you will live longer healthy. Thank you.
Thank you, sir. Dr. Aravinda Kumar, concluding remarks, sir.
It's only prevention. So it's a preventable disease. Prevention is the best way of treating any major problem. So identify the risk, understand the risk, and prevent a heart failure. That's most important. It means that whatever the structural disease is happening, either because diabetes, hypertension, dyslipidemia, whatever it may be, or your habits like your smoking, alcohol, everything has to be under control. And preventing a heart failure is more than the treatment. Treatment is always going to be tougher, costlier, having more morbidity and difficulty in life, and more burden to the family and socio-economic status of the family. So prevention is the more important mantra. Have a good, healthy lifestyle, daily walking for 40 minutes, optimal diet. Do not take any food after 8 o'clock. Avoid biscuit, bakery, and sweet. Do not weight gain. You will have a good, healthy life. You prevent any major event, no heart attack, live happily. That's the mantra today.
Thank you, sir. Dr. Manakar, your comments, sir.
I wish everybody the World Heart Day, which is there tomorrow. That's the first wish I would like to convey to my colleagues as well as the audience. The second important thing is we give a lot of importance to heart in terms of our movies, and we romanticize the heart. But I wish that at least half an hour a day we spend to do something good for our heart. So the things that Dr. Arvind Kumar sir said, Dr. KP, if we can even devote half an hour for our heart per day, I think that would be a great service we are doing to something which we romanticize a lot, but I don't know whether we care for it that much. So even we care like 2% of our time every day, if we can allot for our heart, I think we will do a great service in reducing the incidence of heart disease, because all said and done, prevention is any day better and cheaper than cure. Thank you.
Thank you, sir. So that brings us to the end of this webinar. I thank all three panelists for sharing their views and elaborating on various aspects of heart failure, its prevention and treatment. I hope your insights would have been beneficial for the participants. I thank all the participants for taking part in the session. Thank you, one and all. Thank you, sirs. Thank you.
Thank you.
To come out, leave.